Drooping eyelids are a really common concern as we age and happen for a variety of reasons. Now, what's important to know is when non-surgical options are appropriate and when it's important to have a conversation to discuss whether surgery is a possibility. Now, as we age, we lose collagen in our skin and we lose elastin in our skin, which does mean the skin itself becomes more lax. So the upper eyelid skin is already the thinnest skin on the entire face, and we do find that that becomes looser. But changes in the shape of the human skull also contribute towards the upper eyelid anatomy as we age. Now, when we're young, our eye sockets are relatively horizontally inclined and lead to it even slightly upward turned. And as we age, that changes. So the bone around the eye socket is resorbed and the eye socket starts to become bigger and to turn more downwards. So this lack of framework for the eye area, the fact that there's less bone around the eye socket and around the brow, can mean that you've got less pulling on it, and so there's more laxity. So when we're thinking about how we treat loose eyelid skin, it's important to think about exactly what has changed. And many people do well with a skin tightening treatment, and in particular for me, I'm a fan of Softwave in this area. Softwave is a non-surgical ultrasound treatment which uses ultrasound purely within the skin at a depth of about 1.5 millimeters to stimulate collagen and elastin. And on the clinical studies that Softwave have done, shows an average lift to the brow area of 3 to 4 millimeters, and it's achieving that simply by working on tightening the eyelid skin. But it's also important to consider those structural changes that I just mentioned, and actually treating the face with facial fillers can be a really effective choice for many people. Perversely, treating the cheek, people think, how does treating here impact on here? But because we're actually managing to elevate the lateral canthus, or the outer corner of the eye, when we're treating the cheek, we're putting the support beneath it in, and it gives the illusion of turning the eye back upwards. And then by treating the temple, we're putting this tension back through the eyelid skin, and it can really make a difference to how much eyelid show you have. We can also think about using some wrinkle relaxing injections strategically around the frown area and around the tail of the eyebrow to achieve maybe a 1 to 2 millimeter lift around the eye. So there's quite a wide range of choices depending on how severe your eyelid skin is and exactly what is happening in you. The gold standard, in my opinion, at present is still surgical blepharoplasty. And if someone has more severe heavy eyelids, I will have a conversation with them about whether they're open-minded and would consider surgery. And if they are, it's a very minimally invasive procedure which heals really surprisingly quickly. But if they're not, then we can still talk about the options through non-surgical techniques to get best results. If this content has been useful for you, please give it a thumbs up or send me a little message below, and please do subscribe if you'd like to see more content like this.